I'm Dr. Mark Wortman of Summit Family Dental. This is our first vlog that we are sending out as a way to directly communicate with you. So I decided to pick some topics that I get a lot of questions about, and today's topic is going to be about dental whitening. So I decided to put together 5 common questions that I get asked a lot about dental whitening. So the first one is how does it work? Dental whitening is done chiefly through 2 products. One is carbamide peroxide, the second is hydrogen peroxide of varying concentrations. The actual process itself is an oxygenation reaction that releases the agent and flushes the stain out of the teeth and changes the color of the teeth. Question number 2, will my teeth be sensitive? The answer to that question is yes, but to varying degrees. So typically the whitening agents vary in concentration. As the concentration of the whitening agent increases, I typically see more sensitivity. However, sensitivity is transient, usually goes away in about 24 hours and is very tolerable. If you have very, very sensitive teeth to, say, ice cream, cold water, let us know. It'll help us decide on what product to help you to minimize sensitivity. Question 3, is it safe? Yes. However, we should be involved in the process so that you can use the materials in a safe way. All the materials that we use are ADA certified, they're safe products. We've used them ourselves, our patients, our friends and family, but they have to be done under our supervision. So, for instance, take-home gel. I see a lot of people overfill their trays, seat the trays, and then have tissue trauma from the whitening agent along the gum line. So it's important that you follow our recommendations, and if you do, the results are really good and very safe. Question number 4, are the results permanent? And the answer to that is yes, but the habits that we do on our daily lives will cause the teeth to darken. So the example I like to give is, here is your baseline shade. Use a whitening product, and over time your shade elevates to here. Now there's a little bit of rebound, so after, say, a day or 2 after your teeth are whitened, you're going to rebound a little bit, and then the daily habits that we do may bring the shade down even more, so things like coffee, tea, colas. But typically you don't ever go back down to where you started at. Now, oftentimes people like to do touch-ups and whiten periodically to kind of maintain that level of whitening, but the results will typically stay above your baseline. Question number 5, will it affect my dental work? And the answer to that is no. However, if you have anterior fillings, crown and bridge work, those will not change shade. So we have to take that in consideration. So the best thing to do is to come in, have us take a look. We'll do a consultation, we'll take a look at your existing work, and we can set sort of a realistic expectation about what we can and can't do through whitening. And also, it gives us an opportunity to get a baseline shade. So if we're going to, say, match up dental work in the future to the new shade, we can sort of establish that baseline, remeasure after the whitening, and then get a shade that we can work with to try to get everything to match up as best as we can. So now I'd like to talk about the products that we currently offer at Summit Family Dental. The first one is Phillips Quick Pro. This is the latest version of Zoom. So what they've done with Phillips Quick Pro is they've taken away the light, they've decreased the amount of time that it takes to whiten your teeth, and they've also decreased the sensitivity with this product. It's great for someone who wants instant gratification. They want to get their teeth done quickly, inexpensively. You got a wedding you got to go to, you got family photos, you got graduation, all sorts of things. You can come in, have this done in a half hour, and get great results. The second product we offer at Summit Family Dental is the traditional take-home trays. So with this, you come into the office, you get impressions taken, we fabricate custom trays that fit your teeth, and then you get a bleaching product. This is Bravo Perfecto, made by Premier. And you place the whitening agent in the tray, seat the tray, take off the excess, and wear them for 15-20 minutes. The results are fantastic. The sensitivity is way less than it used to be. And the beauty of this product is that you can control the level of whitening. So if we're trying to match something, you can do a couple of days of this, stop, see where you're at. You can do more. You can go for longer periods of time. You can pick up extra tubes if you want to do more. So this is a great product when you really want to be in control of the whitening. And lastly is Opalescence Go. This is a new product as well. These are pre-filled whitening trays that you can wear. You basically come into the office, pick up a box, you have a certain amount of trays in here. When you're done with them, basically you throw them out. The results are great. The sensitivity on this is also very, very low, and we get great results with this. Patients really like this. So if you're interested in any of these whitening products, let us know. You can call us at 586-726-0606 or email us at contactus@summitfamilydds.com. We'd love to hear from you, any questions you have. So we're going to reach out with more vlogs on a variety of topics, so feel free to let me know if there's anything you want me to cover. Thanks for watching.